What is this? Why am I getting this bill? I went to an in-network provider for this office visit. I paid my copay, but I'm still getting a bill? I don't understand. I need to figure this out. I need to call my doctor's office, or I'm going to call the insurance company about this bill, because I should not be getting this bill. My name is Tamika, and I'm a certified professional biller, a certified professional practice manager, and an AAPC approved instructor. Today we're going to be discussing allowed amounts, balance billing, in-network providers, and out-of-network providers. But before we do, don't forget to subscribe, like the video, and share it with all the people that you know who are interested in medical billing. Also remember that when I reach 1,000 subscribers, I'm going to be giving away this book right here. And I just love it. Maybe I should put it up again so that you can see it. It is brand new. I bought it to give away to one of you lucky winners. So make sure that you subscribe in order to have a chance to win when I reach 1,000 subscribers. Let's jump into it. Now we're going to start off with allowed amount. What exactly is the allowed amount? Because if you have looked at a explanation of benefits, a EOB, or a remittance advice, a RA, then you will have noticed that there's something on there called the allowed amount, which is pretty clear because it is the amount, which is the maximum amount that the insurance company is going to pay the provider for a specific service. The services being CPT codes, HCPCS codes, etc. So the allowed amount is the maximum amount that the insurance will pay for a particular covered service. Now, if it's a non-covered service, then the insurance company is not going to pay anything because they don't cover it. But if it's a covered service, this is the allowed amount that they are going to pay. Now, you have negotiated with the insurance company as a provider, as a healthcare provider. They negotiate with the insurance company on when they decide to be contracted with that insurance company. They negotiate with them on a fee that they are going to accept from that insurance company for a particular service. So for example, if you negotiated a 99214, which is an office visit with, let's say, Cigna, you negotiated as a provider $250 for that service. That is the allowed amount that the insurance company, Cigna, is going to allow for that particular service. So you may have billed another amount, you may have billed a higher amount, you may even have billed a lower amount, which I hope you don't do. You want to get the maximum amount that you can get, but the max that you're going to get is whatever you have negotiated with them. And this is for in-network providers, because in-network providers are those who contract with the insurance. Now, as an out-of-network provider, that means you have not contracted with the insurance. However, there is still a reasonable amount that the insurance company is going to pay out for a specific service. So again, you may bill for a 99214, you may bill as an out-of-network provider $500. That does not mean that the insurance company is going to allow, or they think that $500 is reasonable for that particular service. Hope I made that clear. Either way, whether you're in network or out of network, there's going to be a cap, I guess, a specific amount that you can't go over, or that the insurance company is not going to pay over that specific amount. Now, balance billing is the difference between your fee and that specific amount, that allowed amount. So again, you may bill $500, but the allowed amount is $250. And if you decide you're going to bill the patient for the difference between the $250 and the $500, which is $250, then you are considered to be balance billing the patient. Now, as a in-network provider, you're not allowed to balance bill. Within your contract, you're stating, I'm contracting with this specific insurance, and the amount that we agree upon is such and such, and so I will not bill or receive any more money than this specific amount. So this is what's in your contract as an in-network provider. As an out-of-network provider, you don't have a contract, but you're still limited to the amount that you can bill a patient if the insurance doesn't pay for the rest. Now, you may have, as an out-of-network provider, you may be banned from balance billing, depending on what state you live in, because different states have different laws, and they decide, well, even though you're out of network, there's still a limiting amount that you can get, and anything between that amount and your fee, it cannot be billed still, even if you are an out of network provider. There are some places where you are allowed to bill the difference, and actually on the EOBs or on your remittance advice, it will say that. You can see on it, it will have a little note that, first of all, it will have a note that you're considered out of network. Then it will have something that tells you how much you billed, how much they consider the allowed amount is, what they pay if they do pay anything. And below it will tell you, this is the patient's amount and this is, what we paid. So it will tell you that on the explanation of benefits. If there are also some that may say that you can't bill the patient for the difference. And you should read all of these codes on the EOBs and the remittance advice, just so that you can be clear about what you can or cannot do. Now, there are self-pay patients and there are uninsured patients. And just to be cleared, uninsured patients are patients who do not have any insurance. That's why they're considered uninsured. And for a long time there, I thought uninsured and self-pay were the same thing. I was like, well, an uninsured patient is a patient who doesn't have insurance. A self-pay patient is a patient who doesn't have insurance. But that is not true. Again, an uninsured patient is a patient who doesn't have insurance, but a self-pay patient may have insurance, but they decided they don't want to use their insurance. Now, remember, you're allowed to do that. You may have insurance, but you decide for this particular visit, you do not want to use your insurance. You may have to sign a form or something like that while you're in that office, but you have the right to do that as a patient, to say, well, I don't want to use my insurance this time, or I want to use my insurance this time. So as a self-pay patient or uninsured patient, you still should not get a bill that's astronomical. You still should not get this. You go in for a specific procedure and then you're coming out with thousands and thousands of dollars worth of debt. And what they have been noticing was that is what was happening, especially when patients go to the emergency rooms or, in air ambulance and stuff like that. They've been noticing that has been what's happening. Now, a lot of the debt that people have nowadays is medical debt because, the fees are getting so expensive. It's really high. And so they noticed that was happening. And they wanted a way to help the patients not have such a big balance. Now, the No Surprise Act, I think it started in 2020, and it kind of was, put out there and was eased into, but I don't think most people were using it. But as of January 1st, 2022, it became mandatory, and I'll read to you what it is. It protects people covered under group and individual health plans from receiving surprise medical bills when they receive most emergency services, non-emergency services, from out-of-network facilities and from out-of-network air ambulance services. And this is from cms.gov. It also provides new dispute resolution opportunities for uninsured and self-pay patients. And so I guess in layman's terms, you can go to a hospital and the hospital is in network with your insurance company, but then the hospital hires out-of-network providers. And so you would get a bill from this out-of-network provider and your insurance company is not covering it because they're out-of-network. But how would you have known that? You had an emergency, you went to the hospital is in network, yes, but the provider isn't. How would you know that? Also, with self-pay patients, when you go to certain services now, you don't have, or self-pay or uninsured patients, you don't have insurance, or you decide not to use your insurance. So now you go to a hospital, or you have an air ambulance service, and you get in this huge bill that you can't afford. So this act pertains to people who have insurance, but they go to out-of-network providers, or people who are uninsured or self-pay. Now, within this act, you have to supply the patient with a good faith estimate, a GFE. Now, this good faith estimate needs to be no more or no less than $400 of what the services will equal up to. So let's say you go to a provider and you have an office visit done, and you also have a procedure done. Now, you are an uninsured patient. They need to let you know how much that service is going to be. And they need to be within $400. You need to give this good faith estimate within a timely manner. So if I made an appointment over the phone and my visit is not until 10 days from that appointment, I think they have 3 days to give me that good faith estimate, or up until 3 days before the visit to give me that estimate. But if I made an appointment and it is within 3 days, it's 2 days, then they have a certain amount of time to give me that good faith estimate. Long story short, they need to give me this estimate before I get in and before, I'm seen, so that I can know if I can afford to pay it. Again, this is going to be a lot of work on the front desk, because they're going to have to try to figure out how they're going to do that. If you're a practice that have a lot of patients coming in and out, that's going to be kind of difficult to do. That's something you have to add on to what you tell them that they need to do. So, a lot of people are still trying to figure it out. I don't think the act itself has been completely, I know there's going to be some revisions, because there are a lot of questions as to how things are going to be done. When patients make appointments, number one, sometimes they don't tell you everything. They might say it's just for this one thing. So when we make the appointment, now we're thinking it's going to be one thing, but then when they get in the doctor's office, they're telling a whole slew of other things. Or it's just that they're not a doctor, so they don't know what you're going to, after I tell you that I have frequent urination and it's painful, I'm not sure that you're going to say, oh, it's a UTI, so I need to give you a straight cap. Like, I don't know that because I'm not a doctor. So they may tell you the correct thing, but then it's only until you get in the office that you know certain things are going to happen. And also, I just wanted to mention, too, that insurance such as Medicare, Medicaid, and TRICARE, also and VA, there was already a no balance billing law in place for that. So if you have a patient who has Medicaid and you bill Medicaid again $500 and Medicaid only pays you $100, you cannot bill that patient for $400. So this was already in place for those insurances, and now it's in place basically for everyone. So I hope I really cleared that up. I might have been a little confusing. I hope I wasn't. But if I was, just leave me a message below and I'll try to clear it up for you. Knowing about allowed amounts and balance billing, especially if you're in medical billing or in the revenue cycle, is important to know, because you'll have to be dealing with it all the time, whether you're at the front desk, in the back, wherever you are. So I hope you enjoyed that video, and be sure to check out this video right here. Before you leave, don't forget to subscribe, and I will see you in the next video.